Am I talking?
Yes.
Are you getting the message?
Yes.
All right. So that condition, after that condition, after like 6 weeks, when you go back and do the test, you find out that the patient is actually HIV positive, because that time the antibodies are well produced, but not in everybody. This window period is for some people can have it. Some people, as soon as the virus enters, they will start producing the antibody. You might or you might not pick the antibody, but certainly after 3 months of infection, a person is supposed to detect. That's why when you go to a hospital today, you do HIV test. You go, they will tell you to go back after 3 months if the HIV test is negative, because they don't know whether you are recently infected. You are in window period. All right? They want you to come back to the hospital after 3 months. We want to test and find out whether HIV is there or not there. Okay? So there is another recurrent minor problems. Person may be having some signs and symptoms, not specific. It could be flu, catarrh, headache, fever, and the non specific. You say, probably the person has malaria. You go to hospital, doctor will prescribe anti-malarials for him. He will go back home, he will finish the drugs. The fever will come back after some time. Okay? So that's where that person was. Defining illnesses, progressive deterioration, and finally,
land of no return.
It's return in the future.
So those are the years or the duration that these stages can actually take. From 0 to 12 weeks, as I said, that is that stage. Alright, the window period stage, and then the asymptomatic stage, the person might not show signs and symptoms. That one can take years. And this is very dangerous. Person doesn't have any signs and symptoms that he has got HIV. But he has the HIV. Alright? Most people don't know that they are infected, because they have not gone to do a test. So when they have sexual contact, they keep on, distributing the virus in the community. You understand what I mean? Good. So actually, that is the most dangerous stage. So window period, as I said, a person who is positive may test negative during this time, from 4 to 6 weeks. For some people, it may take up to 12 weeks. This is very rare, although for it to be up to 12 weeks, and the virus can still be passed to others. So what are the signs and symptoms that you might see in somebody who is HIV infected? As I said, some might not have any symptom, but some can present with some minor signs, some with major signs, depending on the level of deterioration of the CD4. Okay? Some of the conditions include chronic or intermittent unexplained fever. These are the major signs. Chronic or intermittent diarrhea. Person may be having watery stool all the time, over a month. Or wasting, severe unexplained wasting. You see somebody just emaciated, just losing weight without any concurrent illness. He doesn't have any other illness, something that you cannot explain. Or maybe he's not eating well or something, but you find out that this is an unintentional weight loss. The person keeps on, going down and down. Chronic cough and some cancers like Kaposi sarcoma. Don't worry, you'll get used to the names as time goes by. Alright? Then minor signs include swellings, lymphadenopathy. You find that the lymph nodes keep on swelling, the neck, alright, the axilla, the groin. You find out that the person is having lymph node swelling. Recurrent fungal infections, skin diseases like itchy rashes. You find out the person has some itchy rashes, always scratching the body. Herpes simplex infection and herpes zoster, shingles. Alright? Now, what do we do to prevent ourselves from acquiring this infection? What do we do? Since we know that this is the route where this infection can be transmitted, what are we supposed to do at our own level? ABC. Alright, ABC. That's very good. Alright, so we're not going to go to the B and the C in this our setting. You know what I mean? A means what? Abstinence from sexual intercourse. B,
Be faithful.
for those who are married, they should be faithful to their wives or their husbands.
Like us.
And the C is the use of condom. So as I said, for our own setting here, hello. For our own setting, we need to emphasize on the abstinence. Alright? And this abstinence can be primary or secondary. That is what they call FLHE, which is Family Life and HIV Education. Very good. You all know it? Eh? Very good. This makes this concept well accepted, because when you talk of sex education, people will